nearly 4 out of 5 patients had a positive result, with complete remission for 1 in 5. Many of these patients had exhausted all other treatment options.
It works in a very different way and is able to work even when our conventional treatments have been ineffective.
Venetoclax is an example of a new class of targeted drugs which attack very specific cancer-causing biological factors like cell structure mutations.
Cells, when they're born, are destined to die, and cancer cells, in particular leukemia cells, delay that death by using a protein called BCL2 that stops the normal time of death. Venetoclax works by specifically blocking the action of that BCL2 and allowing the cells to die in the way that they were destined to.
The drug was entirely developed and trialled in Melbourne and is based on research started 30 years ago at the Walter and Eliza Hall Institute. It's been given fast-track approval for use in the US and the European Union, but it's still not been approved here in Australia.
Oh, kidding.
It's the need for it, I think. We want this sort of targeted therapy so it can knock out the cancer cells, leave everything else alone.
The future of cancer treatment lies not in the blunt instruments of chemotherapy and radiation, but in targeting therapies to hit specific cell and gene abnormalities.
We will probably see some of these treatments able to be matched to a particular genetic profile of the individual or the cancer.
Already this year alone here in Melbourne there have been some major breakthroughs in the genetics of breast cancer and pancreatic cancer, which is fast becoming one of the world's biggest killers. And with this billion-dollar cancer hospital and research facility just opened, there are high hopes for much more, especially in the revolutionary field of immunotherapy.
So this is one of the labs where the team is looking at the mechanisms by which the cancer cells evade recognition by the immune system and looking at the most effective combinations of drugs to allow the immune system to recognise and kill the cancer cells.
Over the last decade, immunotherapy has provided incredible new treatments for cancer. It works by harnessing the body's own immune system to defeat cancer and has been used most effectively so far in melanoma.
So come November 2014, we had multiple sites, and those, because of the number of sites and some of the locations, deemed inoperable.
Greg Lawson is testament to the incredible power of this new breed of drugs. When the melanoma he'd beaten a decade ago re-emerged with a vengeance, Greg was put on an immunotherapy drug that had not long been approved for the Australian market. 12 months later, his melanomas were completely gone, and he had suffered virtually no side effects.
Truly amazing. The fact that it's actually given me a position where I have no cancer in my body at the moment is a great feeling.
But Greg knows only too well that immunotherapy doesn't work for everyone. Tragically, his wife Jill developed melanoma